this week's edition of The Health Story. My name is Dede Harris. I'm the Executive Director of Walton Wellness, a nonprofit located here in Walton County dedicated to the prevention of lifestyle-related chronic illness, focusing on diabetes and heart disease. And each week I like to bring you some kind of tidbit of information or either interview someone that I think you might find interesting, something that will benefit your health journey or your family's health journey. And today I just want to talk a little bit about something that you've probably been hearing a lot about in the news, which is whooping cough. And I know that you've heard the term probably through the years, but recently we've heard a lot of things about whooping cough because we're seeing a lot more cases. And in certain areas of the country, they're actually considering it to be outbreaks of whooping cough. And some of you may be saying, what is whooping cough? It certainly has a funny name. What is that? That's actually the infection. It's called pertussis or pertussis. And you actually do get vaccinated if you have your children on a regular schedule of vaccines from the time they're born. They actually are vaccinated for pertussis. It's put in typically with the diphtheria tetanus shot, and they call it a DTaP. And so the pertussis vaccine is included in that. So if your child has had a regular schedule of vaccines, they have been vaccinated against the whooping cough or pertussis. However, they are seeing that there are some outbreaks happening in older children as well, which is making them wonder, is the vaccine actually working as well as it should be, or is it starting to wear off as children are getting older? So these are some of the things that the CDC is actually working on investigating and looking at. Why are we seeing more cases of whooping cough? Another idea of why there might be more cases they are considering because lots of people are choosing not to have their children vaccinated these days because of all the controversy with the autism and all of those type of things and the possible interactions. Some parents are choosing not to vaccinate their child from birth or delaying it, so then they are being exposed to the whooping cough infection and actually getting them. Now, as I have shared with you before, a vaccination doesn't mean that you are not going to get that particular infection or disease, but typically what it means is that it will be less severe, just like the flu shot. Many of you, I'm sure, have heard of someone or even yourself have had the flu shot, and then you get the flu and you're so mad because you had the flu shot. But typically that flu infection will be a lot less severe than it would be if you didn't have the flu. Same thing with the whooping cough or pertussis. And the symptoms of whooping cough or pertussis start out much like the common cold. It has the same kind of symptoms: runny nose, a mild cough along with it. But when it's truly the whooping cough, that cough hangs on and stays, and it has a very distinctive sound to it as well. A whooping cough sounds very different than just a child who has a bad cold. And a doctor definitely can tell the distinction between a regular cough and a whooping cough. I encourage you, especially now we're right here, school's about to start in a week or so, and so all of our children are going to be getting together and sharing all their germs with one another, which we all look forward to as parents. But I will encourage you to, if you have a concern, or if your child is around a child who you know is not vaccinated, I will encourage you to visit the CDC's website and check out some of the facts about pertussis, or talk to your pediatrician, or talk to our local Walton County Health Department. They can advise you as well to make sure that your child doesn't need a booster shot, or to make sure that they have been vaccinated with the pertussis vaccine. It is important to note that this particular infection is most dangerous for infants. It does seem to affect most severely children under the age of 1. As I said, we are seeing cases in older children, but it doesn't typically present as severe as symptoms as it does, and it is most dangerous to the infant. So it's definitely, if you are pregnant or you are going to have a new baby, around your family or in your home soon, then it's definitely something worth just a few extra minutes to update yourself on exactly what is going on with the whooping cough and its vaccines. As always, you can find us on the web at www.waltonwellness.org, and you can always try me the old-fashioned way by phone at 770-315-8107. Thanks for watching.